My name's Dr. Andy Lee, and I'm the neuro-ophthalmologist here at Houston Methodist Hospital. And today we're going to be talking about a very common symptom called flashers and floaters. And we're going to be discussing them from a neuro-ophthalmic standpoint because flashers and floaters normally means retina problem. So in your eye, there's the front of the eye, which is like the cornea, and then you got the middle of the eye where the lens is, and the lens is what can get a cataract, and then you got the retina. Inside the eye is this liquefied gel called the vitreous, and then the back of your eye is the retina. So normally, if you have flashing lights or floaters, these are retina symptoms. And that's because a floater is just condensation of the vitreous. So when you're looking out, if you see a floating thing, a little spider web or something, that's a floater. And that represents the vitreous, and it's connected to the retina. So if the vitreous pulls too hard, it'll pull off your retina. And that's called the retinal detachment. So flashers and floaters need a retina examination because what we're looking for is making sure it's not a vitreous detachment or a retinal detachment. However, what if you have flashers and floaters and and there's no retinal detachment? This still could be neuro-ophthalmic. So the way that we're going to help differentiate the neuro-ophthalmology versions of the flashers and floaters from the retina is not only to look at the back of the eye, but to examine the patient and talk to the patient some more. So what could cause something that makes flashers and floaters and is not in your eye? So that would be something in your brain instead of your eye. And one of the features that's going to be important is it's going to be bilateral. So if you have a retinal detachment, you're only going to have the symptoms in that one eye. And if you have a vitreous detachment and floaters, it's usually only going to be one eye. But if it's bilateral and simultaneous, both eyes at the same time, then what we'd like to know is what exactly are you seeing in terms of the flashing light? And for young people, the most common cause of seeing a flashing visual field phenomenon that is bilateral and simultaneous is migraine. And what we call that when you have the visual component is called aura. So migraine is the headache. It's usually pulsatile, throbbing. You have to go lie down, turn off all the lights. Lights and sounds bother you, nausea, vomiting. But with migraine aura, patients see a bilateral, simultaneous, positive, meaning they see something, visual phenomenon. And so if they have their visual field like this, it's often drawn as a jagged line. So they see this jagged line. It can start small and then get bigger, start small and then gets bigger. That process is called march and buildup. And the flashing part is they see flashing inside of the jagged line. And that we call a scintillating scotoma because it's flashing. So scintillating is our fancy word for it's a positive phenomenon. I see something and it's a flashing component, or colors or kaleidoscope. These are very common descriptions for migraine aura. In floaters, they can see the vitreous floater, but if you close your eye and it's a floater, it goes away. But if you close your eye and it's still there from a floater, that means it's not in your vitreous. That means it's in your brain. So one of the other things we use to help differentiate brain from eye is, does it go away if you close your eyes? And if it's still there, if you close your eyes, from the floater and flasher standpoint, and if it's bilateral and simultaneous, we really should be thinking about brain. And even though migraine is the most common cause for the positive transient phenomenon, lasting 20 minutes and then the headache follows, it could also be seizure. And so occipital seizure can also produce a bilateral simultaneous flashing. It's often described like little tiny balls of color. Obviously, it's going to be bilateral again. So it's going to be colored little balls. It lasts seconds at a time. No headache follows. So the two things that we have to worry about with flashing and floating as a symptom, other than the retina, is it your brain from bilateral, simultaneous, positive phenomenon? If it's the squiggly line version, that's called a fortification scotoma. The scintillating is the flashing light. 20 minutes and the headache follows. That's migraine. However, if it's seconds to a minute at a time, no headache, and little colored balls, that one is the occipital seizure one. So we need to know that flashers and floaters is usually a retina problem, but sometimes it's your brain.